1. Insertion. The needle is gradually inserted from the shallow region to the deep region to obtain qi, and to reach the desirable depth. Clinical application. After insertion, the needle is thrusted from the exterior region to the interior region, and from the shallow region to the deep region for the purpose of obtaining qi, or directing qi to the location of the disease. Method. After insertion, the needle is gradually pushed from the shallow region to the deep region till the required depth. 2. Rotation. The needle is rotated repeatedly to reinforce stimulation, promote and strengthen qi sense. Clinical application. To reinforce stimulation, to induce and to reinforce qi sense. Method. When inserted, the needle is rotated repeatedly forward and backward. 3. Twisting. The needle is twisted to one direction, as that for twisting a thread to strengthen the qi, and guide qi to spread to one direction. Clinical application. To maintain, promote and discharge qi, to induce warm or cold sensation. Method. When the needle is inserted into the acupointment, the thumb twists the needle, as that for twisting a thread, until sunken, tense and muscle-twined sensation is felt beneath the needle. 4. Flicking. To flick the needle with fingers during the retention of needle, and to slightly shake the needle. Clinical application. To strengthen and promote qi circulation and get qi. Method. During the retention of the needle, the handle or tail of the needle is flicked and the body of the needle is slightly shaken. 5. Scraping. The handle of the needle is scraped by the thumb or index finger to promote or to reinforce the qi. Clinical application. This method is used to promote the flow of meridian qi when qi sense is not obtained. If qi is already obtained, the use of this technique can promote the transmission. Method. If qi is not obtained after the needle is inserted into a certain depth of the acupointment, the belly of the thumb or middle finger leans against the tail of the needle, and the nail of the index finger scrape the handle of the needle frequently from the lower to the upper to promote get qi and move qi. 6. Finger moving. This method is used to move the needle with fingers to reinforce stimulation. Clinical application. To strengthen stimulation, to promote qi flow. Method. The index, middle or small fingers move the needle body to strengthen stimulation. 7. Stirring. To stir the retained needle to reinforce qi, and to promote qi flow. Clinical application. To reinforce qi, to promote the flow of meridian qi. Method. To stir the retained needle by backward-forward rotation, lifting or thrusting. 8. Swinging. The fingers hold the body of the needle and swing from the left to the right. In the withdrawal of the needle is swung to induce the leakage of qi. Clinical application. This method is used to reinforce qi, promote qi flow to discharge pathogenic factors. It is helpful to swing the needle to enlarge the needling hole for purging excessive factors and clearing away heat. Method. The fingers rotate the handle of the needle and swing the body of the needle in the withdrawal of the needle. The needle should be swung upward and downward from the left to the right. In the withdrawal of the needle is swung to enlarge the needling hole, and then is swiftly withdrawn. 9. Swaying. The fingers are used to hold the handle of the needle, and to sway it from the left to the right to promote qi, and the flow of meridian qi. Clinical application. This method is used to promote the flow of qi. If qi is not felt after needling, slight swaying of the needle can promote qi. When qi is felt, the swaying of the needle can promote qi to flow to a distant region. This method is often used to reinforce and to spread qi. Method. When qi is obtained, the needle is lifted a little and held between the thumb and index finger to sway slightly and frequently from the left to the right. 10. Swaying for dissipation. When needling the regions around the nodules, swaying for dissipation is used to move the body of the needle to disperse the sensation and to dissipate the nodules. Clinical application. To dissipate nodules and to eliminate lumps. Method. When the needle is inserted near the tumescence around the nodules and after qi is obtained. The handle of the needle is held between the thumb and index finger of the right hand. To move back and forth like a pendulum clock within 45 degrees. 11. Swirling. The needle is swayed in a circle to reinforce stimulation and to relax the muscles on the abdomen. Clinical application. To regulate qi flow, to harmonize qi, and to strengthen qi for the treatment of abdominal pain, abdominal distension and dyspepsia. Method. The needle is swirled around for 3-5 circles with an angle of 5 to 40 degrees formed by the body of the needle and the skin. It usually on the abdomen area.
Swirling usually used in abdominal area after insert the needles and getting heat sensation, and make a big circle around the pulse area, thus helping qi and circulation in that area, thus swirling.
12. Tremoring. When holding the needle, the hand slightly shakes the body of the needle to tremor it. Clinical application. To promote qi and qi flow and to reinforce qi. Method. After being inserted into a certain depth of the acup ointment, the needle is held by the right hand to manipulate with lifting, thrusting and rotating techniques in high frequency and small range, so that the body of the needle is slightly tremored.
Tremoring. After insert the needles, and moving the needles pretty faster and combination with upper down and rotation the needles same time. So that's what we call trimming. So use this way help the qi go to the local area, help qi circulation there.
13. Thrusting. The inserted needle is quickly lifted and thrusted in the same region like a bird pecking food. The needle is lifted, thrusted, and rotated swiftly in a small range. Clinical application. This method is used to promote the coming and flow of qi. It can reinforce qi sense and maintain qi beneath the needle.
13. After insert the needles and make the needles heavy go down, slightly up, heavy go down, slightly go up, so that help qi go to under the needle area. So keep the qi under the needle area. So that's we call thrusting.
14. Pushing by rotation. When qi cannot flow to a distant region, this method is used to promote qi flow by rotating the tail of the needle. Clinical application. To promote qi flow. Method. If qi is weak to flow to the distant region, the thumb and index finger mildly lift the needle up from the region with qi. The tip of the needle is pointed to the direction for qi to flow. The thumb rotates the handle of the needle forward to the posterior transverse lines on the belly of the thumb, then the needle is mildly rotated back. This procedure is continued for several times or over a dozen times.
Lift the needles a little bit and put the needle direction go to where you like to sending qi. Then rotation the needles and then come back slightly and then pushing the needles go to the direction again. So in this way can help qi moving to where the illness location. So that's what we call pushing by rotation.
15. Pushing. To push the needle down a little to reinforce qi. Clinical application. To reinforce qi and to supplement qi. Method. The needle is pressed down a little, but is not thrusted and lifted.
After insert the needles and put the fingers holding the skin, pressure there for some time.
16. Suppressing. To press the tail of the needle after insertion. Clinical application. To promote qi flow and get qi, as well as to strengthen stimulation. Method. To press the tail of the needle with the index, middle, and the fourth fingers after qi is obtained to enable the body of the needle to sink.
Suppressing. After insert needles, put the fingers over the top of the needles, pushing qi go down. So that's we say suppressing.
17. Knocking. When the needle is inserted, the tail of the needle is knocked by fingers to gradually push the needle inside. Clinical application. To promote qi flow after qi is obtained so as to keep, reinforce, and spread the qi. Method. When qi is felt, the tail of the needle is knocked by the index and middle fingers to gradually push the needle tip inside.
Knocking. After insert the needles, we tap the needles with the fingers and moving qi more strongly and tonify qi here. So that's we call knocking. So tapping the needles slightly and make the needles go to more deeply, gradually. That's what means knocking.
18. Flying. The fingers hold the handle of the needle, and the needle is rotated and released. When releasing the needle, the stretching fingers look like a flying bird. Clinical application. To promote qi and qi flow and to strengthen stimulation.
Flying. After insert the needles and help to getting qi, we can fly in the needles. Put the fingers to the needles and release. So we can rotate the needle same time and release. So flying, we have different way to fly in. One way we just release the needles. Another way we can hold the needles as the finger moving. That still means flying.
19. Bending. When qi is felt after insertion, the needle is bent to one side to be manipulated. It's also called lying needle method. Clinical application. This method is usually used to promote qi flow and to direct qi to the focus of the disease.
After insert needles, and then lifting the needles to the shallow location and bending the needles, the top of the needles go to where the illness directions. So that's sending qi to that direction. That's we call bending.
20. Picking. When qi is obtained, the point of the needle moves and picks on both sides of the meridian. Clinical application. To strengthen stimulation, to promote and to direct qi flow, and to disperse along the meridian. Method. After qi is obtained, the needle is held by the thumb, index and middle fingers of the right hand and bent slightly. The point of the needle moves and picks on both sides of the meridian, as to pick something out from the tissue.
Picking. After insert the needles, and then holding the needles, use the top of the needles. Let be picking here to help the qi go to the direction, follow the channels. So that way we call picking.
21. Protruding. The needle is held between the thumb and index finger, and is pressed and moved by the middle finger to control the transmission of qi to one direction. Clinical application. To strengthen stimulation, to promote the flow of qi, to direct qi, and to enable qi to transmit along the meridians. Method. When qi is obtained, the needle is lifted a little. The thumb and index finger hold the handle of the needle, the middle finger presses and flicks the body of the needle, or bends the body of the needle to one side so that the body of the needle looks like a bow. To direct the qi to transmit upward, the needle is bent downward and backward. To direct the qi to transmit downward, the needle is bent upward and forward. 22. Bending and cushioning. One hand bends the needle to one side, the index finger of the other hand cushions the body of the needle on the skin of the needled point. Clinical application. To promote and direct qi to the location of the disease.
Bending and cushioning is another way sending qi to the illness directions. So after insert the needles, and then use one finger pushing by side of the needles, and the other hand bending the needles. So that's bending and cushioning.
23. Seeking. Seeking means to seek for the meridian qi. Method. If the qi is not obtained after the insertion, the needle is thrusted up and down and from the left to the right to seek for the meridian qi till qi is felt.
Seeking is the way to searching qi. So put the needles go to different directions and searching, thus getting qi and connected with different meridians qi. So that's searching.
24. Withdrawing. The needle is lifted from the deep to the shallow region during the withdrawal of the needle. Clinical application. This technique is for the manipulation or withdrawal of the needle. Method. In the manipulation, the needle is withdrawn gradually and steadily. Or in the withdrawal of the needle is retreated.
Withdrawing. Moving the needles from deeper position gradually to the shallow position. It usually used with withdrawn needles. That's withdrawing.
25. Retaining. The needle is withdrawn beneath the skin, halted for a while, and then pulled out to avoid impairment of tissues caused by too forceful or too quick withdrawal. Clinical application. To avoid the impairment of the tissue or bleeding in withdrawing the needle. Method. The needle is lifted to the shallow region, retained for a while, and then withdrawn.
When we withdraw the needles to the shallow position under the skin, stay there for some time, just in case cause bleeding, then withdraw it. So that's we call retaining.
26. Lifting. The needle is lifted a little to reduce or eliminate qi felling. Clinical application. Reducing qi felling if it too strong. Method. To lift the needle slightly to weaken qi sense, the techniques of lifting and thrusting are avoided.
When after insert the needles, patient feels too strong the qi sensation in there, we can lifting the needle a little bit and then leaving there. Thus we say lifting.
27. Pulling. When the tip of the needle is withdrawn beneath the skin, and there's the smooth and unstagnant feeling, the needle is pulled out just like the pulling of a body hair to avoid pain caused by the withdrawal. Clinical application. To avoid pain and bleeding caused by the withdrawal. Method. The needle is gradually withdrawn beneath the skin. When smooth and unstagnant feeling is sensed beneath the skin, the needle is lifted out just like the pulling of a body hair. 28. Pressing the acupoint. Pressing the inserted acupoint after the withdrawal of the needle to alleviate pain and to prevent leakage of qi. Clinical application. To prevent qi leakage, to strengthen qi, and to avoid bleeding, or to stop bleeding. Method. To press or massage the needled acupoint after the withdrawal of the needle.
Pressing the acupoints. After withdraw the needles, use the fingers or cotton ball, immediately pressing for the acupoints to preventing qi linking and prevent bleeding or stop bleeding.